Discussing how congestive heart failure is treated is Heart Center cardiologist Dr. James Lyons. Dr. Lyons, how is congestive heart failure treated?
The treatment of congestive heart failure starts with some simple changes to their patient's diet and lifestyle. Most important of these is decreasing the amount of salt intake in your diet. The amount of salt that you take in will contribute to fluid retention, and in someone who has heart failure and is having trouble with swelling and fluid retention, this will just exacerbate the problems. After these lifestyle changes, most patients will need a combination of medications. These medications are designed to improve patients' symptoms. They are also designed to improve the heart function in some cases, and most importantly over time to help patients to live longer and prevent the complications of heart failure. For some patients who fail to respond to these medications or who have more advanced forms of heart failure, there are more invasive or advanced therapies that are needed. For example, some patients will need a special type of pacemaker or intravenous medications to help treat and manage their heart failure.
Is congestive heart failure reversible?
In some cases it is. There are some conditions that can cause heart failure in which treatment with optimal medications can actually improve the heart function and return it completely back to normal. In most cases, however, when we treat heart failure, we're looking to improve the heart function as best we can, if not completely back to normal, to improve the symptoms, with the goal of getting the patient back to maintaining as normal a lifestyle as possible.
What is the Heart Center approach to treating congestive heart failure when it is detected?
Sure. Here at the Heart Center, we take a team approach with our doctors and nurse practitioners to develop an individualized treatment plan for each of our patients. That can include, in the early stages, helping patients make their lifestyle modifications and dietary changes, including nutrition counseling. We will get patients started on an individualized medication regimen that is right for them with the balance of the right medications and doses, and help them to get to their ideal target doses. In more advanced cases of patients who are failing medical therapy, we have the ability to do special types of pacemakers, we call biventricular pacemakers here at the Heart Center, that can help patients with their symptoms. In addition to that, we have the ability in the inpatient setting to treat patients with intravenous medications in the short term or sometimes in the long term to help their symptoms. For our truly advanced patients or end-stage patients, sometimes these therapies are not enough and we need to look at more advanced treatments such as transplant evaluation or referrals. We can do a lot of the evaluation for those patients here in our practice and get them to the appropriate centers where transplant can be done if need be. And for more advanced therapies called mechanical circulatory support or assist devices for patients with failing hearts, again, we can do the evaluation for patients here, have them referred to the appropriate center to have those devices implanted, but we're able to keep them here locally to do their follow-up after they have this type of therapy done.